Good morning, friends. In this series of my case presentations, I have treated in my last 49 years of my practice. I am going to narrate you an interesting case of surgical shock, post surgical shock, which is a very rare opportunity for us to treat. This has happened something like miraculously when one of our senior doctors in Gudivada has come to visit his relative who got operated for this suprapubic cystostomy, that is SPC, that is called. That was conducted in the General Hospital in Yelur. He, along with our Guru Dr. J.L.N. Shastri, they came to visit him on a Sunday evening. On Sunday evening, they called me to come to the General Hospital also. I also went there. And the patient is operated for this SPC, suprapubic cystostomy, for this stricture urethra. And after the surgery is over, even after 1 hour, 2 hours, or 3 hours, or 4 hours, the spinal anesthesia is the patient has not recovered from the anesthesia, and also he showed the signs of shock, that is excessive sweating, low pulse rate, and some other things. They have given the medicines like atropine or some other medicines, and yet he is not recovered by the time we went there, by about 7:30 or 8 in the evening. And our Guru Dr. J.L.N. Shastri has asked me whether I am having this medicine, strontium carb, with me. That is news for me. I am not having that medicine with me, strontium carb. No, sir, I am not having. Whether we can get from any other source. On that day, since that was a Sunday evening, the shops are also closed. Sorry, we forget about it. And I have not gone through it, the medicine also, at that time. And after about 1 year or so, when I went to Udvada, Dr. J.L.N. Shastri, I asked him, what is this strontium carb, why you have asked me to get that medicine on that day. He told me, you might not have read it, you go and read it in Hypercom, that will come. What is that, sir? You are telling strontium carb and you go and read it in Kent Matra Medicum. I went and see that Kent Matra Medicum for this strontium carb. That is not there in the book itself. Actually, we are having about 185 remedies in our syllabus, in our DHMS course. At that time, in the first 2 years, we are expected to complete 85 remedies, and in the third and fourth years, we are expected to complete another 100 remedies. But all the medicines will not be there in the syllabus. But the lecturers used to tell everything as per the syllabus. In the first year and second year, our lecturer used to tell as per the alphabetical order, aloes, arsenical, aconite. Like that, the remedies were taught, and we took the notes. In the third and fourth year, Dr. M.K.S. Kutumbrao, learned lecturer, he has given us extra energy with his lectures with comparative materia medica, and he mixed all these medicines and used to tell lengthy lectures very interestingly, no doubt. But this strontium carb has not come into our picture in those 2 years or 4 years. So this has after about 6 or 7 years of completing our, even 8 years of completing this diploma, I have come across this strontium carb. Even then, I have not studied it. He told me, Dr. Jeelan Shastri told me, you go and read Hypercam, you will know about it. What is that, sir? It is not the strontium carb, it is Hypercam you are telling. Yes, you are go and read it, that will tell you. And strontium carb is not in the Kent Medicam. After about another 1 year or 2 year, one of our friends in Kakinada, he has purchased a computer and asked us to test whatever symptoms you want, that will come here, that like this. I asked him whether this Metromedicas are there. Yes, it is there. Yes, I asked him immediately to go to this Hypercam remedy, and we went through all these things. Only in the last but one para, it is there as the shock symptoms. Whenever this cold pulse and dyspnea, severe dyspnea, low pulse rate, all these comes under shock symptoms, and carbo is used to be the normal remedy. But what Kent has given his lectures in hypercamus, for a medical doctor it is carbovis, but it is for a surgeon, if he faces this type of situation, this is the medicine strontium carb. He wrote it in the last but one para of that hypercam. Then I got the got it right, and I purchased a strontium carb 201 dilution at that time, and I utilized it in something like 1986 or so, when one of my friends, a surgeon in Eluru, he is faced exactly this type of situation. Of course, the surgeons may get this type of cases at so many times, see surgical shocks, and all these patients will be recovering from atropine or something like that. But I asked him to give me a chance to use this medicine, since the patient is also related to us. Yes, you can use it, he told me. Yes, I immediately took that medicine, strontium carb, and 200, and put it in half glass of water, lukewarm water, and gave the first dose after stirring directly into the mouth of this patient, who is in the condition of shock after having this hysterectomy, that is a lady patient. And after another 15 minutes, I stir the solution anti-clockwise 15 to 20 times and gave another dose of strontium carb. And after another 15 minutes, say half an hour after starting this medicine, 3 doses were given, and immediately the shock symptoms, from the shock symptoms, the patient has recovered. Pulse rate has come to normal. The sweats and all these things have gone, and the dyspnea and all these things have disappeared within half an hour after giving about 3 doses of strontium carb in graduated doses. That is how I have given to one of our few, where we will get the chance to treat like that only in few cases of surgeries. Like that, about 4 or 5 surgeons have given me a chance to use this medicine, strontium carb, and got recovered about 5 to 6 patients from this remedy. So we need not think that all are the rare remedies. Every remedy is having its own utility, and we have to be thorough with the knowledge of all the remedies which are there in this Materia Medica. And that is the message I wanted to give with this episode of post-surgical shock I have treated. And I have also treated, as I told you, about 6 or 7 only cases in the lifetime so far, and got good benefit out of it, and brought good name and fame to homeopathy. Thank you very much.